Patient as a beam emitter in the pathology problem, chapters 16 and 17. Attenuation. Attenuation is the reduction in the total number of X-ray photons remaining in the beam after passing through a given thickness of material. So again, we know that it's going to either do one of two things. It's either going to absorb or it's going to scatter. X-rays are attenuated exponentially. So again, X-rays are attenuated exponentially. Attenuation. The beam emitted from the patient after attenuation contains the radiology significant information needed by the radiologist to make a diagnosis. It is affected by thickness, atomic number, density. So the thicker the part, the higher the percentage of attenuation. With the atomic number, the higher the atomic number, the higher the percentage of attenuation. Density, the quantity of matter per unit of volume, describes how tightly the atoms of a given substance are packed together. The greater the density, the higher the percentage of attenuation. So an example of high atomic number items that we use in radiography would be like lead and barium. You've got a nice little table of attenuation or of atomic numbers on 16-1, and then again in table 16 or 12-2 there are tissues percentage and different levels of kVp for that type of tissue. Again, that's nothing that you need to know for the exam, but it's just information that might help that be understood a little bit better. So this is showing us how our body is composed and the body as an attenuator itself. So we've already talked about knowing that we are made up of like air and fat and muscle and bone. So this chart you will need to know for the exam that hydrogen is an atomic number or Z number of 1, carbon 6, nitrogen 7, oxygen 8, and calcium, which is bone, at 20. Air. So again, there are 4 major classifications of attenuators, and they are air, fat, muscle, and bone. So what we need to know about air is that it's naturally present in lungs, sinuses, GI tract. Its effective number is 7.78, lower density than fat or muscle, and absorbs fewer photons, produces greater image receptor exposure. Fat. Effective atomic number is similar to water's and other soft tissue, such as muscle, but muscle is a little bit more compact. So only slightly lower effective number than muscle. So if we were going to experiment with fat or something like soft tissue, we could use water experiments. It has less tissue density than muscle, and volume of fat varies considerably from person to person. Muscle. So the effective number is slightly higher than fat at 7.64 exactly. The tissue density is slightly higher than fat, greater attenuation of the X-ray beam than fat because, again, it's more tightly compact. And so an example that you're looking at here is of your psoas muscles. Bone has a high content of calcium. So again, we're looking at an atomic number of about 20 that makes up bone's high attenuators. Effective atomic number is high, your tissue density is high, attenuated beam percentage is high, but that means your image receptor exposure would be low. The higher the absorption, the less that actually reach the image receptor, which is why the exposure is less in the end when you're talking about bone. So let's look at this image. This shows us all 4 of those prime attenuators in our body. So we can actually see air in the stomach and in the colon. We see fat around the kidneys, which is why we're able to visualize them so well on X-rays. And then we see our psoas muscles to both the left and the right of the spine. And then, of course, we can obviously see some bone there as well. Patient and image quality. So we're going to talk about these individually, but to begin with, we're looking at subject density, subject contrast, subject detail, and subject distortion. So let's start with subject density. The impact the subject has on the resultant radiographic density. Image receptor exposure will be altered by changes in the amount or type of tissue being irradiated. So increased subject density, image receptor exposure remains the same. Let me say that again, meaning you might see this again. Increase in subject density, the image receptor exposure remains the same. Subject contrast. The degree of differential absorption resulting from the differing absorption characteristics of the tissues in the body. It is dependent on specific characteristics of an individual patient's tissues. So in mammography, where you have low, and think of lungs, it has high because you have heart, lung, and actual bone itself. Subject detail is also known as recorded detail, is dependent on their position within the body and also on the body's placement in relationship to the receptor, such as size and shape. It's why we position certain exams the way that we position them. And again, we'll talk about size and shape a little bit more as we progress forward. Subject detail actually is a whole chapter on its own a little bit down the road. Subject distortion. Distortion is misrepresentation of the size or shape of the structure of interest. So a little bit later, like I said, this one also has its own very own chapter a little bit later on. So we kind of discuss magnification, and it's why we do obliques for apophyseal joints. All right, pathology and radiation absorption. Patients are radiographers' greatest variables, with beam attenuation dependent upon thickness and composition of the patient's tissues. So again, the greater the attenuation, an increase in tissue thickness, an increase in effective atomic number, and you end up with an increase in tissue density. So this is showing you an example of a couple of pathologies and how that might affect the thickness and composition of the patient's tissues. So the first one is pneumonia, and the second one over here to the right would be emphysema. And these are in your book as well on 17-1. So obviously with pneumonia, it's an increase in the actual density, and then emphysema, it's actually taking something away. So pneumonia, it causes air-filled lung tissue to become filled with fluid, so it does have greater absorption of radiation. With emphysema, normal lung tissue is destroyed and the air sacs become enlarged, so you have less absorption of radiation. Small localized pathology does not require a change in technical factors. This next couple of pathologies here, we're looking at a small tumor compared to like a larger tumor. And that's an example in your book as well on 17-2. So our role as a radiographer, or our responsibilities: reading the requisition, taking an accurate patient history, close observation of the patient. There is no magic formula for technical factor adjustments. It really just takes time and experience. And again, our whole purpose is to reduce the amount of exposure, and we can do that by reducing repeats by getting a good patient history in the first place to know if one of those pathologies exist. The extent to which a body part is affected by disease will determine if technical factors must be altered. So adjustment in technical factors must be significant enough to impact the visual difference in the resultant radiograph, which we've already mentioned with density. If our eye want to be able to visualize it, then we're going to at least make an adjustment of 25 to 30%. But most of the time we make adjustments with mass or with density in doubling or halving. So you're going to at least double that mass to our overall exposure so that we can see a better image if halving to do a repeat. Digital image detector systems will have a wider range of technical factors which produce acceptable images. And again, we kind of know that. We see that with what we do, that you have a lot of area of in between. So keep exposure to a minimum without compromising the image quality. So again, think of Alera. And you'll hear me mention this quite a bit throughout this semester, that our whole goal is to reduce the amount of radiation that we're given to our patients. So in order to do that, just because we can make an image with a higher technique doesn't mean that we always should. So you still should use the least amount of technique possible. Additive conditions. Increased tissue thickness. They have an effective atomic number and or density. So they increase attenuation, which inversely related to image receptor exposure, which we already kind of talked about that a little bit before. So again, if we're increasing the tissue thickness and atomic number, what do you think we would need to actually do to our technical factors? Again, think of the word additive. So we're going to have to increase our technical factors with additive conditions. Require an increase in technical factors, which we just kind of discussed. Thicker, denser part requires more penetration. So the general compensation to do this would be with an increase in KVP by 15%, because for our eyes to actually visualize KVP, we need at least a 5 to 15% in KVP is normal, which would double the image if we don't compensate for it. So we know that by increasing KVP by 15% actually changes our exposure. And so AECs automatically adjust most of the time for this. So if you already have a set KVP, it'll make the adjustment for the body part or for the extra additive condition. So let's look at some additive conditions. So the first one we're going to look at, and these are all in your book, you've got a great little table in there that's 17-1, and it summarizes all of it together. But you will need to know definitions of these pathologies for your exam. So as I kind of go through, you can either write out the long definition or you can choose to kind of simplify. So all I'm doing is just using one key term that will help identify that pathology. So if we're talking about multiple systems, abscess, an abscess is just an infection. Edema is really just swelling. And then tumors, there's a misperception out there that a tumor means that it's cancerous or something along those lines, but really it just means new growth. In the chest, atelectasis, which is the collapse of a lung. Bronchiotasis is chronic dilation of the bronchi. And again, if you break down these words, you'll be able to identify their meaning or their term. Cardiomegaly, you've probably heard this one before quite a bit already, which is just enlargement of the heart. Congestive heart failure, or CHF, is heart failure, just kind of like it's within its definition there. Emphemia is pus in the thoracic cavity. Pleural effusions, it can either be hemothorax or a hydrothorax. So hemo we know means blood, and hydro would be some type of fluid. So just as fluid in the lung or fills with fluid. This is some examples. So the first one that we're looking at, hopefully you can identify that as a collapse of a lung. So that is atelectasis, and we've talked about this one previously. The one here is just enlarged heart, so that would be cardiomegaly. And this last one would be pleural effusion. Again, if the fluid fills from the bottom up, then we know that it would be pleural effusion. So some other pathologies that we'll discuss. Pneumoconiosis is inhalation of dust, and so this was really big for like miners, and what would happen is they end up with a lot of scarring within their lung cavity. Pneumonia is inflamed lung. Pneumoectomy, so ectomy means removal of, and so that's removal of the lung. Pulmonary edema is fluid fills lung tissues and alveoli, and it's commonly associated with CHF. tuberculosis. It can be advanced or miliary, and it is an infection by microbacteria. Look at some more examples here. The first example that you're looking at is pneumoconiosis. The second one would be tuberculosis that we can see. And the last one over here is going to be pulmonary edema. So increased attenuation or additive conditions within the abdomen. Aortic aneurysm. This is large dilation of your aorta. Ascites, which is fluid within the peritoneal cavity. Cirrhosis, which is fiber optic changes in the liver. And then calcified stones, which can really be within the gallbladder. It can be within the kidneys. So it's not just designated in one specific area. So here's some examples. The first one that you're looking at is aortic aneurysm. And the second one, which is a really great picture, you don't see it very often, but those are actually gallstones. So with extremities and skull, acromegaly, so we know megaly means large, and this is considered to be overgrowth. Chronic osteomyelitis is bone infection. Hydrocephalus is fluid-filled cerebral ventricles. Hydro always means some type of fluid. Osteoblastic metastasis is actually cancer in the bone. If we see metastasis, it always is some form of cancer. Osteochondroma is a tumor in the bone and cartilage. And so oma means tumor. Paget's disease ends up with new bone growth. That one's kind of a harder one to explain, but I'll show you an example here in a second. And then sclerosis, which is actually hardening of the bone. So this first example here is Paget's disease, and so it's just kind of more bone being grown on top of more bone. So again, just growth, new bone growth. And the other one over here is acromegaly. So you can kind of see how enlarged the features are. Destructive conditions. So this will end up with a decrease in tissue thickness, in the effective atomic number, and or density. So it does decrease attenuation and is directly related to the image receptor exposure. So with a decrease in tissue, then it is also going to require a decrease in technical factors to properly expose the image receptor. General compensation is through mass. So again, what rule did we discuss with mass and making adjustments? We're either going to double it or half it. So again, it's minimal 25 to 30%, but we really want to make a huge difference. So we'll double or half the actual technical factor. So hint, may need to know that additive conditions we adjust with KVP, destructive we adjust with mass. So let's talk about the multiple symptoms. Anorexia nervosa. This is an eating disorder. Atrophy means wasting away body tissue, part or body. And emaciation is wasting away body tissue, which reduces body. So this is showing you a couple of examples here. The first one is going to be atrophy that we see on the woman. And then, of course, the other one would be anorexia. With chest, emphysema, we've already kind of talked about a little bit. But again, emphysema is an overdistension of air. So again, your lungs kind of decompose and you just have that overextension or overdilation of air. Pneumothorax is free air in the pleural cavity. So you can kind of see here which one would be viewed. This would be a pneumothorax. You can see that dark black within that lung like a big old air bubble, and that's a pneumothorax. So in your abdomen, aerophagia kind of sounds like air, and it is the swallowing of air. And so it is an abnormal pathology. Bowel obstruction is air trapped in a bowel, and that's through or because of impacted fecal material. Extremities and skull. So active osteomyelitis is a bone infection. Aseptic necrosis. Necrosis means death, so this is death of bone tissue. Carcinoma is bone cancer. Degeneration arthritis is inflamed joints. Fibrosarcoma is tumor of the bone. And gout is metabolic disease. Our examples here, the first one is going to be fibrosarcoma that we can see within that tumor of the bone. And then the second one is gout. So some more extremities and skull. Hyperthyroidism. This is going to be oversecretion of your actual thyroid. Multiple myeloma is malignant tumor. Osteomyelitic metastasis is spread to bone, so it's cancer spread through the bone. Osteomalacia is defect in bone mineralization, and then osteoporosis is a defect in bone production. So here are some examples. Again, the first one that we're looking at is multiple myeloma, and the second one that we're looking at is osteoporosis, and it's just that degeneration of the bone, so it's kind of breaking down. And here's a couple of case studies that you can look at. And that is the end. If you have actually made it all the way to the end and are using this video to help, I am going to give you a couple of bonus hints or thoughts of what is going to be on that exam. So one of the terms that you might need to know the definition for would be osteochondroma. So osteochondroma and its definition, and ascites, will be on the exam. Another good information that you might want to know is always pneumonia and emphysema that we discussed a couple of times within this chapter. So again, I'm not going to give it all to you, but those are some helpful hints for the exam and for actually spending the time to watch this video. Thank you.